I'm Millicent Walker. Here are some of the highlights this hour. Presidential Task Force on COVID-19 warns against flouting non-pharmaceutical guidelines. Ekiti State Government halts reopening of worship centres, expresses displeasure at disregard for safety guidelines. And India passes 1 million cases of coronavirus. We begin with the latest figures from the Nigeria Center for Disease Control, NCDC, which puts the total number of confirmed cases in the country at 34,854 cases. Those that have been discharged are 14,292, and the deaths so far at 769. Only in 24 hours, 595 new confirmed cases. The NCDC reported, and also 9 deaths, which increased the numbers to those figures. The 595 new cases are reported from 24 states: Lagos with 156, Ondo 95 cases, Rivers 53, Abia 43, Oyo 38, Enugu 29, Edo 24, the FCT 23, Kaduna 20 of those cases. Akwa Ibom 17, also 17 cases more in Anambra State, Osun as well, 17 cases, 14 in Ogun, while there are more cases in Kano are 13, 11 in Imo, Delta 6, Ekiti 5, Gombe 4, Plateau as well 4, while 2 in Cross River, Adamawa 1, Bauchi 1, Jigawa 1, also 1 in Yobe State. Now, over in Ekiti State, the government has put off the resumption of religious centres, earlier fixed for this weekend by a month. The government, in a statement by the Commissioner for Health, Dr. Mojisola Yaya-Kolade, says Christians in the state are obviously not ready yet to comply with the set protocols and preconditions, judging by a recent statement issued by the Christian leaders in the state. Now, ahead of the reopening of schools across the country, the rector of the Kaduna Polytechnic, Professor Idris Bugaji, says the institution under his leadership has taken all necessary measures for safe reopening for students and staff once it gets the federal government's approval. Speaking to reporters after a meeting with some student union leaders, the rector proposes a staggered reopening of lectures whereby only the final year HND and ND students will be allowed to resume for lectures and write their exams, after which other students will be allowed to come in and take their lectures and exams before the entire school activities can resume fully. Stating that the COVID-19 pandemic will take some time to go, the rector notes that all needs to be done now for citizens and institutions to adopt all these safety guidelines against the virus.
My position is COVID-19 is not something that should scare everybody. People are really stampeding unnecessarily. We have to find a way to live with it. We in Kaduna Polytechnic, we have made all preparations. We have gotten our own sanitizing machines. We have gotten equipment that can even measure your temperature, not even the ordinary one. We have even a UV-based sanitizer, ultraviolet. Ultraviolet, we are using web range of about 210 to 220 nanometers. This bandwidth of ultraviolet radiation is not harmful to the eyes, and it doesn't penetrate your skin. So by the time you pass through it, if there's any virus of any type or even germ, it will kill it, and you'll come out very safe. We also have, all the other arrangements for spacing and whatever.
Well, joining us for more as to how to keep down the spread of the virus, we have in our Lagos studio a public health practitioner, Dr. Shalom Oni. Thank you for joining us.
Yeah, thank you, Millicent.
Also joining us via Skype here in Lagos. Been a busy day, traffic day. Just been told that a pharmacist, Yinka Duole, will join us shortly on the program. So let's begin with what the Presidential Task Force on COVID-19 has said. The novel virus, people are learning a lot more about it 6 months into since the virus outbreak, but it's insisting that they need to enforce the non-pharmaceutical measures. But looking at the trajectory of the spread of, the virus, and taking a particular look since you're in Lagos and practicing in Lagos, how do you think Lagos is doing? And this is in terms of perhaps even before Monday, we had cases at around 400 and 500. And yesterday we saw quite a larger spike, about 695. But even at that, in the last 2 days, Lagos has recorded quite a substantial amount of the daily influx of the spread of the cases.
Well, before we go to the non-pharmaceutical interventions, and the enforcing of the same, honestly, I want to look at what is our direction as a country, as a state, as far as COVID-19 is concerned. Are we saying we want more Nigerians to become COVID positive so we can, try to see those who can develop antibodies and immunity
sort of
towards
immunity.
this? And we have talked about this before, that even the antibodies that the COVID-19 virus stimulates is short-lived. At the end of the 3rd month, the antibody seems to fizzle away. So you want to look at it that, well, as a country, where are we heading? Are we saying, no, we take this virus so serious, we want to reduce the spread, we don't want too many people to have this while we're waiting for the vaccine, And if that is the direction we are going, then the body language, the resources, the focus must be in that direction. And that must inform the steps, the policies, and the measures we are putting in place by time. So it looks as if, we are a bit confused. We don't really know where we're going. Because if you're looking at, we don't want more people to have this virus, then we have to increase our testing. You look at other African countries, the testing capacity has increased, and so also the detection. Some of them are having hundreds of thousands of cases. If Nigeria is the most populous black nation in Africa, and our cases are low compared to other African countries, then something is not right somewhere. So for me, that aspect we need to really put our hearts together.
But I know you talked about testing, but even as it stands now, we're being told that states are not meeting up to their daily testing capacity, even though they have the molecular labs and gene expert machines to indeed test. So, there's perhaps the demand for tests isn't there, so they're not missing the target. And then how do we ramp up testing?
Well, states are not meeting up with the capacity, right? But then people are willing to know their COVID-19 status. So there is a disconnect somewhere. It's either other reagents that are needed to conduct the COVID-19 test, are lacking, or the sites are not made available to the grassroots where people can easily walk in and do their testing. Because if you're talking about availability of testing, that yes, molecular labs are there, but you want to bring the testing site, the sample collection site, close to the people. Yes, the molecular labs are just about 40 in nationwide, but then you want to bring.
They've even expanded it.
Yeah, you want to bring the sample collection site to the ward level, where people can just, at a stone throw, walk towards a particular place, do their testing. Then you take the sample to the labs where you can process and feedback. So, that logistics has to be, top-notch. Otherwise, there will be a disconnect. It looks as if, yes, the labs are there. It looks as if you are ramping up testing capacity, but people are not willing. But then there's something in between.
So on the non-pharmaceutical measures, what do you expect? How can the government and the agencies responsible to flattening the curve, how can they help?
Well, on the non-pharmaceutical interventions or the measures, we have 5 categories. We have the personal protective measures for individuals. We have the social distancing, and physical distancing. Then we have the environmental measures. Then we have the travels, restrictions. So these are measures, that come together to talk about the non-pharmaceutical interventions. Now, so you want to look at this and say, okay, plus the face masking. Now, you want to look at this and say, okay, yes, how can this help us, to flatten the curve? As a nation, we must begin to look at the balance, the epidemiological benefit of the non-pharmaceutical intervention and the socio-economic cost that it is to the nation. So there must be a balance between the two. And I believe that all the sectors, needs to come together and look at and follow the steps. There are basic steps you need to follow, for you to be able to flatten the curve, and yet there are no socio-economic burden on the nation. Now, the first step is this. You want to assess your capacity, your air capacity. Do we have enough air capacity to handle the cases that we are having? Because you must not overwhelm your capacity. That's very important. Now, the second thing that you must do is that you must categorize your MPIs. In terms of categorizing your MPIs, you want to look at it and say, okay, yes, what is the public perception of our MPIs? At a point in time, people are no longer following the face masking thing, the social distancing, because they were not seeing it being practiced by other people, that they expect in the community. So what is the public perception of your MPI? Now, what is the visibility and the cost affordability of your MPI? That's another thing you want to look into, as far as the MPI categorization is concerned. So apart from categorization of MPI, then you want to look at the extent of your of the COVID-19. Then you move into deciding whether you want to relax or whether you want to strengthen, or whether you want to totally improve.
Lift.
Yeah, exactly. So these are things all the sectors need to come together and look into in terms of the MPIs and how they can help us, to flatten the curve. It's an ongoing process.
So just quick, before we let you go, there've also been, we've heard, certain risks with staying in closed, crowded spaces, poorly ventilated spaces, and close contact settings with people holding conversations. This is like an office setting, isn't it? Where there is perhaps less ventilation, more of the ACs are being used. How indeed can they protect themselves?
Now, in an office setting, what NCDC are advocating for now is that you increase ventilation, because even extreme cold weathers, can aid the transmission of the virus. So you open up the windows, cross ventilation, if possible, the doors. In fact, as been said in the clinic now, in the hospital settings, you don't shut the doors of your consulting room anymore. Open it up. So increase the ventilation so that you can reduce the transmission as much as possible, because there are asymptomatic cases that you may never know may have it. So poorly ventilated areas will aid transmission. Then you want to do teleworking. Yes, people are now buying. There's an increased public perception, good public perception towards teleworking. People now want to work from home. People don't want to face traffic. There's an ongoing traffic now, at the Kara side there. Yeah, so people want to stay back at home and do teleworking. So it's part of the things that we are trying to look into that will help. Then those who are sick don't come to work. It's a new normal that we must begin to look into. Then the personal protective measures must be there. Personal hygiene, hand washing, and all that stuff must be there. Then less chatting at workplace. These are things, that must, come into play. Yeah.
All right. We'd like to thank you, public health practitioner, Dr. Shalamuni. Thank you for joining us on the program.
You're welcome.
Now let's go to Yobe State, where the government has distributed food palliatives to widows, orphans, the most vulnerable persons in predominantly Christian community in Damaturu, the state capital. Governor Buni, who is represented by the Executive Secretary of the State Emergency Management Agency, STEMA, says the agency has so far reached out to communities in 15 local council areas of the state.
This is the Director of His Excellency, the Executive Governor of Yobe, Honorable Member Buni, to identify and reach out to all vulnerable households across the state within available resources and reach out to them periodically. Christian community is not just a community that is occupied by Christians. As you can see, there are Muslims here, but it's a predominantly Christian community. And when we reach out to other communities, we realize that there are also vulnerable households in this community. So we reach out through their leadership. They came up with lists within our available resources, and we are now here supporting them with the palliative of COVID-19.
This administration looks at humanity, not religion. And that is why you see many of our brothers and sisters, mothers, vulnerables, the downtrodden, those who are also oppressed, are also part of this and sharing in this. This is a means in order to alleviate the sufferings and also to help in feeding our people. And we appreciate every bit of this on behalf of this Christian community.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. At least 160 vaccine projects have now been launched worldwide, according to German research and pharmaceutical companies. Now, according to the WHO, 5 vaccines were also in phase 1 human trials worldwide at the end of the month of June. Such trials test the safety of the vaccine. 7 are in combined phase 1, phase 2 testing, where the immune response is also tested, and only 1 vaccine is already in phase 3, where the aim is to prove its effectiveness against the pathogen in practice. Well, on the hopes for a vaccine for COVID-19, we have Stephen Beardsley, Deutsche Welle correspondent. He joins us from Berlin. Hi, Steve. Now, only yesterday, international organizations accused hackers from Russia of trying to steal vaccine research. Now, we also know that Germany is working ahead on its COVID-19 treatment solutions. But has there been any threat or impediment thus far?
I'm sorry, you're not coming through that well. Can you ask the question again? I missed it just then.
Okay, so my question is based on the vaccine and how far Germany is going. Is there any threat to, just like what came up yesterday with Russia being accused of stealing vaccine research in other countries?
No, actually none that we've heard of so far. What you mentioned, the intelligence assessment that was released by the UK and other nations, we haven't seen German intelligence involved in that. So far, that's mostly involved the UK and the US, I believe. What was interesting about that was it was a rather detailed assessment that was released to the public. Basically, we knew that months ago there were some reports that hackers were interested in this research, but what the UK and the US and some other nations released yesterday, 16 pages, I believe, they named the hacking group, and they talked about the specific malware that they were using. But so far from the German side, we have not seen any such allegations. We do know that there have been allegations of Russian hacking into German government networks, most famously into parliamentary networks, which back in May, actually, Chancellor Angela Merkel scolded basically Russia for and used some strong words to say that they disapproved of what happened. So we know that there have been past attempts, but so far we haven't heard of anything here.
How accessible is remdesivir? We know that the US said it was buying almost all the stocks of the American maker of the drug, but how is Europe, battling or handling that, seeing as they're also significantly affected by the virus?
Right, remdesivir, of course, is the first drug to show effectiveness against coronavirus, especially those who have COVID in the late stages or in the more advanced stages, I should say. It helps to speed up recovery. The European Union has recognized that remdesivir is very effective. 2 weeks ago, it approved use, but as you mentioned, the stocks are mostly bought up by the U.S. It's an American company, Gilead Sciences, that produces it. And of course, the U.S., like every other nation, has great interest in producing as much of that or buying as much of that as possible. What we've heard so far is that some European parliamentarians, for example, some officials have raised concerns about the fact that remdesivir is so hard to come by. They've even suggested that Europe should introduce compulsory licensing, which means that it allows companies to go around Gilead Sciences' patent and make the product on their own. We have heard from the German government no such calls so far. They've said that they do have a small stock of remdesivir, and given the way the cases are right now, it seems to be sufficient. I think there are going to be some concerns going forward, or at least it's going to be closely observed what happens in the future. And I believe Gilead Sciences itself says that it is trying to expand its production and its network and satisfy those other nations. So right now there is some agreement to keep an observation on things.
All right, well, we'll continue to monitor the developments there. Thank you so much, Stephen Beardsley, Deutsche Welle correspondent, joining us from Berlin. Always a pleasure. Now, I understand we have a health policy and management expert from Indiana University, Dr. Abdulaziz Bako. Thank you for joining us. Dr. Bako.
Yes, thank you for having me.
All right, great. So it's been a while. We spoke to you perhaps a month or so ago. Tell us what's happening where you are and how indeed the efforts are being taken indeed to curb the spread of the virus. I mean, US is still #1 in the world.
Yes, so here where we are in Indiana, we have the situation relatively controlled. The infection rate is not going up, and a lot of the lockdown and social distancing measures are still effective, and we are the city, especially where I live, the city of or the Marion County has promulgated a law that makes it compulsory for people to wear masks, and I think that's what's going on in many parts of the country. A lot of states are mandating the use of face masks, and we have some states where the infection is surging. For example, Florida and other states. Mainly, those are the states that have an increasing rate of infection, mainly due to the fact that, or at least from what we see, some of the lack of they're not following the social distancing advice. A lot of people are not following it, and that's probably the reason that while we're seeing these kinds of surge in infection rate.
All right, let's get your thoughts on perhaps Nigeria and, the progress so far. We've had the presidential task force bring some modifications to the extension of the second phase of the lockdown ease. I'm sure you've also heard about schools. They said should open for exams and then went back on that. And just yesterday, they were talking about warning against flouting the non-pharmaceutical measures as the best, safest way of preventing the spread of the virus.
I think that's absolutely right. We do not have a lot of pharmaceutical options. There are just few drugs like remdesivir and dexamethasone, and those are the only drugs or the few drugs that have been shown to have some form of effect on COVID-19, significant effect. So that makes non-pharmacological or non-pharmaceutical measures to be the best and safest option for people. Yet we have to think about the implementation of these non-pharmaceutical or non-pharmacological measures and think about that in the context of the economic realities of the society. So I think a lot of measures, and we know a lot more than we do before about COVID-19. We know that face masks are really useful, and we know that to some extent if we could make people to act responsibly in terms of trying to prevent themselves from catching the disease, that will be helpful. I think those are the things that we need to start looking into, how we can safely come back to the normal while protecting ourselves from the disease.
All right, we appreciate your time. Thank you for joining us, Dr. Abdulaziz Bako, policy expert. Thank you.
Thank you.
Now, India added a record number of COVID-19 cases, nearly 35,000, and that is in the last 24 hours, breaching the 1 million mark. Now, it has the world's third largest caseload after the US and Brazil, the only 3 countries so far to record more than 1 million coronavirus cases. We understand that India's active cases account for about a third of its total tally, as it has been reporting a high recovery rate and a low death rate from the coronavirus. Now let's take a look at what's trending regarding the latest developments in the COVID-19 fight. Our website, channelstv.com, tells you the latest stories that's happening in Nigeria and across the world. You can take a closer look. You have there the top story, and that is the traffic, the gridlock earlier today at the Kara Bridge. But more on the pandemic you can find on the website and other information. That's the program at this time. Thank you for watching. I'm Millicent Walker. Stay healthy.